Dear friends, I am Dr. Arvind Gupta. I am Senior Physician and Head Department of Diabetes, Obesity and Metabolic Disorders at Mahavir Jaipuria Rajasthan Hospital, Jaipur. What I will be talking to you regarding a very important thing, that the mistakes we are doing inadvertently, voluntary or involuntary, while prescribing the medications or while examining the patients is very crucial. This is what I have talked today in the conference. The first important thing is that what type of mistakes we do. There are different types of mistakes. One is commission, means we don't know, it is sort of a lapses, but sometimes it is a serious lapses which is known as error of omission. And some mistakes we do in spite of we know something, but we write inadvertently in the prescriptions which will be potentially harmful to the patients. Sometimes legally we are implicated for these type of inadvertent mistakes. What type of different mistakes we do on a day-to-day basis? Clinical examination. Most of the time we omit to measure height, weight and body mass index. You know, these days we are prescribing SGLT2 inhibitors, we are prescribing GLP-1 receptor agonist and even metformin. For that we must know the body mass index of the patients so that we can design the doses of the drugs, we can design the different types of the drugs to be used in the patients. Not only measuring the height, weight and body mass index, but also sometimes we do not measure the waistline of the patient. This is very, very important to know the waistline, not only for the diagnosis of the obesity or the some of the comorbid conditions, but also for the prognosis of the patients while prescribing some medications. Then the foot examination is again very, very important and sensitive part of the clinical examination, which most of the time we actually do not do. Simply just see the peripheral pulses or dorsalis pedis of the patient, just palpating that thing. Sometimes the absence of pulse or dorsalis pedic pulse in the foot examination is important for diagnosis of some of the diseases. Similarly, the just simply examination of the foot can diagnose so many things like peripheral artery disease, gangrene or impending gangrene of the patient, where the color of the foot is very, very important. Then comes the fundus examination. Please do screen your most of the diabetes patients, whether it's a type 1 or type 2 diabetes patients. Just for example, it is a painless loss of vision, or just by simple screening, I have seen some patients on papilledema. And when I referred these patients of papilledema to my neurologist colleagues, and they diagnosed as a brain tumor, just by screening simple fundus examination. And this gives again so many things, because some drugs are not to be given in the severe retinopathy, or sometimes it is very dangerous to prescribe those medications in the severe retinopathy. So especially in the pregnancy, the fundus examination is very, very important. Then after the clinical examination, the prescribing errors, what we do on the prescription. Sometimes while prescribing insulin, we write U. Suppose a patient, we have to write the 4U. So we write the 4U. But if you see those prescription, it looks like it is 44 units. And I have seen in the real prescriptions that in spite of the 4 units, the 44 units of the insulin has been prescribed, has been given to the patient. And you know the implications of that. In spite of the 4 unit, what happens when the patient will receive the 44 units? Severe hypoglycemia. Similarly, the opposite things occurs. If you want to prescribe like 10 units of insulin, so you write 10U, but it looks like it is 100 units. And I have seen those real prescriptions that in spite of the 10 units, 100 units and been prescribed on the regular insulin. This is how the prescribing. Similarly, on the prescribing the oral medications, you have to see when you are prescribing GLP-1 receptor agonist, sometimes inadvertently the patient was already receiving the other DPP-4 inhibitors, which should not be there. Similarly, two types of different DPP-4 inhibitors have been prescribed very commonly because of the fixed dose combination, and that name of the drug is seems to be a single drug, but it is not a single drug. There are two drugs into that. So these type of prescribing errors are important. So how to minimize those prescribing errors? To audit your own prescriptions, to audit your own prescribing behaviors. That will give you insight. Similarly, while prescribing the insulin to the patients, I think storage of insulin should be emphasized, or educate the patient regarding the storage of insulin and what happens while traveling. So the insulin should not be stored in the freezer section of the fridge. Similarly, when you are prescribing pens, the needle should be removed before storing on the fridge or anywhere else. Similarly, priming of the 2 or 3 units of the insulin to be primed just before injection, that is very, very important. So these type of small mistakes we do on a regular basis, we can omit or we can correct these type of mistakes just by simply auditing and educating our patients for having prime treatment. Similarly, some drugs, oral drugs, when the drugs should be prescribed, whether it should be before meals, with meals or after meals, is very important for the bioavailability of that particular drug. The pharmacokinetics and pharmacokinetic differs with some of the oral medications while we prescribe with meals, without meals, or the after meals. So that is the important thing about the prescribing errors, and that's why I think we have to see our own behavior. We have to educate our own self, ourselves, as well as to the our staff, paramedical staff and nursing staff, for seeing those type of errors, and we can minimize by these type of education to the patients. Thank you very much.